Good afternoon, friends. Well, we are going to live with all this technology. We have been much behind, not using it for a pretty long time. And we are going to be with it. And I'm sure, though we are a little later started, we will be ahead of lots of things. And I'm really shocked at the way people are still held up here at the end of a conference. I call this as health empowerment. I'm going to give you a small presentation how you can manage your patient the best. How we can bring down that level from 6 seconds of death due to diabetes, or at least stabilize it. That's what we are talking about it now. Our intention, now my presentation is basically to make you how to treat your patient the best. And I'm talking to you with an experience of 5,000 people which have already gone through this program and are doing really encouragingly well. And we haven't been joined as yet by any financial institution or any pharma company. Well, we know our problems, all these problems that we face in the management of diabetes. I'm not going to go through it, okay? Suppose I give you a system which is called as a clinical decision system support. This is a word which comes from Obama Healthcare. It says when you treat a patient, please take the help of a clinical decision support system and then treat your patient. Let's not depend upon our memory anymore. Our memory depends on so many things. If I'm in a hurry, my wife is shouting at me, oh, you're already late for your lunch, and the 10 patients are waiting, you know the way I'm going to react. So this is what we should change ourselves now. And my purpose through this presentation is how are we going to empower our patient to take care of himself. And it's a very smart e-health system. Now if you look at this, if I give you a very smart e-health system, tomorrow you can use this for home care, you can use this for specialist referrals, you can use this for medicine guidelines, for a prescription guideline, you can use this for accreditation, and you can use this for any other telemedicine program. It's a very strong technology process, right from starting from diagnosis to going through all the algorithms in the management, a comprehensive guidance, diet, lifestyle, exercise, yoga, and then a good prognosis. This is what you are going to achieve with your patients when you go through this program or when you use this program. Our health monitoring cycle, when a patient comes to you, assess the patient, you plan his treatment, you implement the treatment, and you evaluate the effect of your treatment. All this will come to you through this program. And what happens to us? Will our business fall? Your business will multiply. Once the EHI program is developed, this program does not cost you anything. It's a zero cost to you. It engages patients as well as his families in long term with you. And it has got a comprehensive risk stratification, an integrated support chain system, and complete e-health and e-health home treatment visits also. And I'm trying to go through the slides very fast, but the slides move slower because I need to finish it. Slides don't move. All right? This is your lifetime involvement with your diabetic patient. Now, what is this electronic health record? It's an analytical record. It empowers patient, gives him a hard copy, gives him a soft copy. It empowers a physician. You have an organ risk stratification as you are treating your patient, and it's not going to take you time. You have a medication guidelines, you have a side effect guidelines. This is web-based, so you can take it anytime, anywhere, it is accessible to you, and you can send it to anybody. Sitting here, my patient wants to take a consultation of his friends in US. On the spot, he can send it to him and get a consultation. It has a detailed nutrition constitution of the whole Indian diet, both North as well as South Indian diets. It's dynamic, and it's based on a number of protocols. And it takes a patient through almost about 25,000 permutation and combination. It took us about 8 years to develop this program. This is basically a CDSS system. Patient-centric, multi-disease, decision support. You get a support to your decision. You get a support to your care, user-friendly, protocol and processes, and scalable. I'll not go through this. These are the protocols which have been used in this system. And what does the patient get? The first thing is what the patient gets is a card, just a small card, and on the card there is a logo here. You just hold your QR. You have a QR web in your smartphone. You hold your QR onto this, and you have your whole patient's data coming to you. 3-page, 4-page, 5-page, whatever data you have, the patient has collected will come to you on your smartphone. You don't have to carry anything with this. Even if you find a patient who carries this card with him, the complete data of the patient will be assessed here. Then we give a 2-page report to the patient, which is this, and we give a 5-page report to the patient, which is basically a complete analysis of the diet that he is taking. You know what he is taking. You know whether he is lacking in vitamins. You know whether he is lacking in proteins. You know whether he is lacking in calories, how many extra calories that he is taking. At the end of a year, at the end of a few days, you can then give him this health passport. We call it as a lifetime passport. If he goes from your hospital to some other hospital, if he goes to some other country, he doesn't have to carry a pile of files. All those reports can come into this one passport, and he can carry it. At the end of it, you have collected 1,000 patients, you want an analysis of those 1,000 patients, and this is exactly what it is. On the spot, we will give you the analysis that you want about your patients. All that you got to do, these are all these things will come inside. There are forms like this. Either you train your assistant to fill up this form. It doesn't take a few hours for you. And take a WhatsApp photograph, send it to us. Or take a copy, scan it and send it to us. Or if you are smart enough, subsequently, this comes to you on a web. You just fill up the thing on a web. You press a button and the report comes to you. It's that simple. This is what the report is. Here the patient contacts, all the details, the clinical history, and then the patient's health trend. Now this patient has undergone this trend thrice. One was in December, one was in January, and one was in March. You look at these reports, there are 10 black spots there. That means 10 abnormal reports there, and there are some gray spots here. The reports are painted. It's black, dark gray, light gray, or white. White is completely normal. Here the patient has got, in March, the record is almost white. Now look at this patient. Will this patient be your patient forever? He knows from his 10 blacks you have brought him to this level. Patient sees this completely thoroughly well, and he follows it with these records wherever he goes. Subsequent to this, you have all the machine reports here. You have all this analysis. Look at this patient. For his heart, there is a 20% risk. These risks are scored painted green, yellow, orange, and red. Now look at this patient. You won't find it difficult to refer this patient to a nephrologist or to make him take the treatment that you want to take him for his sick kidney. And look at this. You can make a stage 1, stage 2, or stage 3 or 4 or up to 5 kidney failure much before even the patient recognizes it. And he knows it as well as you know about it. Then you have the see how in detail the medicines that are prescribed are given to the patient. All that you got to do is just change a little bit and make a next prescription to the patient. And here there are side effects. The patient's knowledge level has been assessed, and there are some advice points to you. Those who are in red are the ones where you have to harp more. Those who are in yellow are the ones which you have to harp less. And those who are in white, you don't have to worry about them. And then look at the list, the food recall list, the macronutrients list, the healthy snack guides. Sorry. And a lifestyle modification which can be given to the patient in black and white. And this is all you see the amount of things that you can get on the spot for the diabetic patient that you have been managing. We've got one of our partners in USA. These are a few of the universities through which these records have gone. And see the few of the remarks that they have given. Comprehensive, one of them said, it's ready for India and global markets. Comprehensive report at a single point. Cultural adaptable report. Look at this Sriram Iyengar, who's the founder of Institute of Algorithms in States. He said, this is a very well done. The holistic outlook is helpful to the patient. Then from Novo Nordisk, we have J.D. Powers remarking on this. Nothing appears to be as comprehensive or in one place as Diabase record. We call it a Diabase record. Cool, new idea. Combined and coordinated information for patient and provider. These are some of the opinions of world leaders which have given us. Christine Norton, this is the man who's our partner from States. So friends, let's measure our diabetes well. Let's share it with the patient. And let's improve it, or at least let us help people stop it where it is. And it's possible only if we make our patients get involved in his health. And this is one report that we have created which will make people get involved in their health. Okay. I think I'm a little ahead of time. Thank you so much.